All right, this is interesting. Food companies are now trying to capitalize on the weight loss drug Ozempic. It's all the rage, kids say. According to fresh reporting from the Wall Street Journal, companies like Nestle and General Mills, they're now pitching their products as natural alternatives or companion products to go along with Ozempic. For more on this, we're going to chat with Jessie Newman now. She's a reporter for the Wall Street Journal. She covers food and agriculture and can help explain what's happening. We were just having an off-camera discussion about just the fanaticism around Ozempic, why people are taking it, why they swear by it. Are food companies seeing this drug and others as a risk to their profits? What's the deal?
You know, I think food companies are really in the early stages of trying to assess what the impact is going to be. So they're beginning, investors are pretty concerned that this could impact, that this could threaten sales down the road. Food executives will tell you, look, there's a lot of unknowns. We don't know how many people are going to wind up taking these drugs, how many people are going to stay on them, what sorts of foods they will want to eat. So they're starting to do their research and brainstorm ways to respond.
Yeah, I think I was just quickly Googling because I feel like Walmart came out with a statement kind of not too long ago talking about concern about people eating less and what that was going to do to the bottom line. But I thought, the article was really, really interesting that instead of worrying about that people are going to be eating less food, focusing on the types of food that people taking this drug may want to eat. And if you're eating less, you're not getting as much nutrients, you're not getting as much protein. So how are food makers targeting these weight loss drug users? Like, give us an idea of the type of products that they might be pitching to them.
That's right. So again, this is very early days. Yeah. The companies haven't said too much yet, but you have companies like Nestle coming out and saying that they've actually been studying these drugs for a while and that they are going to be making companion products that consumers, patients on the drugs will be able to use in order if they're concerned about not getting enough nutrition because they're eating less, or if they're looking to boost their muscle mass. Be sure that as they are shedding pounds, they still are keeping, enough muscle mass. So that's something that Nestle has talked about. We've seen Abbott Laboratories say that they are going to come out with this protein-laden drink that is going to be helpful. Can be used by consumers who are taking these drugs. So there aren't a lot of details yet, but there are a number of these companion products that companies are starting to talk about as a way to ensure that patients are getting the nutrients and the micronutrients that they need while consuming fewer calories.
And often what doctors have said when you have rapid weight loss, and whether it's with Ozempic or something else, is you often lose muscle. So maintaining the muscle with some kind of high protein is going to be valuable.
And Jessie, I appreciate the caveats you're offering because something I've noticed just with American foods in general, the same exact product sold in the States has fewer preservatives when it's sold in Europe because of the guidelines about what you can put in food. In the US, it's to keep shelf life extended. And so if companies are now realizing, wait a minute, more Americans are on weight loss drugs, that's decreasing their appetite to snack on junk food. So if we're going to sell something to them, it's got to be healthy. Might that lead to a shift in what American food companies see as profitable? Cut the junk and keep the stuff people need inside the product.
I think there's definitely a way in which this presents, companies are looking at the opportunities that this might present in addition to the risks. So, there's a number of options that folks have talked about as what they see is available to them. This would be, making smaller portion sizes out of the products that they already offer, or potentially just fortifying their existing products with protein or, other vitamins and nutrients that they think people might want. And then there's opportunities that they say to develop entirely new products. Now, will the products they make be healthier? That's a great question.
Right, I know. I was like, we can only hope, but based on our history, I don't know. They might need more motivation than that. Usually the bottom line is enough. But Jessie Newman, thank you very much.
Thank you, Jessie.
Thank you.